Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mrs. Anderson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Mrs. Anderson, please come in. How are you feeling today?
Hi, doctor. Not great, to be honest. I've been having a lot of discomfort, and I'm starting to get really worried. I've been feeling off for a few months now, but lately, it's been getting worse.
I'm sorry to hear that. Why don't you tell me more about the symptoms you've been experiencing?
Well, it started with some general stomach pain. At first, I thought it was indigestion or something minor, but the pain has become more persistent. It's a dull, constant ache that's worse after I eat. I've also noticed I'm losing weight, but I haven't been trying to. I thought that might be a good thing at first, but now it's starting to feel concerning.
I understand why you're worried. How long has the pain been going on?
It's been about 3 months. It wasn't that bad at first, so I ignored it. But recently, it's become more intense and spreads to my back. It feels like it's deep inside, and sometimes I have trouble sleeping because of it. I've also been feeling nauseous more often, and food just doesn't sit right anymore.
Have you noticed any changes in your bowel movements? Sometimes gastrointestinal issues can show up in more ways than just pain.
Actually, yes. I wasn't sure if it was important, but I've had more diarrhea than usual. My stools are also pale, almost grey sometimes, and greasy. I didn't think much of it, but it's been happening pretty frequently.
That's useful information, Mrs. Anderson. Changes in stool color and texture can sometimes indicate an issue with digestion, especially involving the pancreas. I'm also concerned about your unexplained weight loss. Have you had any issues with jaundice, yellowing of your skin or eyes?
I noticed my skin looks a little yellow lately, but I thought it was just because I haven't been feeling well. My eyes are fine though, at least from what I can tell.
It sounds like your symptoms are becoming more significant, especially with the weight loss, nausea, and now jaundice. Given what you've described, I'd like to investigate further. I'm concerned that your symptoms may suggest an issue with your pancreas, possibly pancreatic cancer.
Pancreatic cancer? I was afraid it might be something serious, but hearing it out loud is a shock. Is it possible that it could be something else?
It's important not to jump to conclusions just yet. Pancreatic cancer is one possibility based on your symptoms, but there are other conditions that could also cause similar issues, such as pancreatitis or gallbladder problems. However, because pancreatic cancer is difficult to detect in its early stages and your symptoms are concerning, I think it's important to rule it out sooner rather than later.
What tests will you need to do? I want to figure this out as soon as possible.
We'll start with some blood tests to check your liver and pancreatic function, as well as a scan like a CT or MRI to get a better look at the pancreas and surrounding organs. We may also need to do an endoscopic ultrasound or a biopsy, depending on what we find. These tests will help us determine whether there's a tumor or another underlying issue.
That sounds like a lot, but I want to do whatever it takes to get to the bottom of this. How serious is pancreatic cancer if that's what it turns out to be?
Pancreatic cancer can be serious because it's often detected in later stages when symptoms become more noticeable, like what you're experiencing now. However, the earlier we catch it, the better the chances of treating it effectively. Treatment options may include surgery, chemotherapy, or radiation, depending on the stage and type. But remember, we're still in the diagnostic phase. We'll take it one step at a time and see what the tests show.
I appreciate your honesty. I've been feeling so out of control with my health lately. It's been affecting my mood too. I've been more anxious and down than usual.
That's completely understandable, Mrs. Anderson. Facing uncertain health issues can take a toll emotionally as well as physically. You're taking the right step by seeking help now, and we'll support you through this process. If you feel like the anxiety or mood changes are becoming overwhelming, we can also discuss ways to help manage that side of things, whether through counseling or medication if needed.
Extract 2. Questions 13 to 24. You hear a psychiatrist talking to a patient called Miss Lewis. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Miss Lewis. How are you doing today?
Afternoon, Doctor. Well, honestly, I'm not sure how to answer that. I've been feeling overwhelmed lately, like there's this constant sense of worry that I just can't shake. It's been affecting everything. Work, sleep, even just trying to relax at home.
I'm sorry to hear that. It sounds like you've been going through a difficult time. Can you tell me more about what you've been experiencing?
Sure. It feels like I'm always on edge, like there's something bad about to happen, even though I know there's no real reason for it. I worry about everything, my job, my health, my family. It's like my mind won't stop racing, constantly jumping from one worst-case scenario to another. I can't seem to focus on anything else, and it's exhausting. Sometimes I even get these physical symptoms, like my heart races or I get short of breath. It's been going on for months, but lately it's gotten worse.
That sounds very distressing, Miss Lewis. It's not uncommon for anxiety to manifest in both mental and physical symptoms, especially when it's been going on for a while. Based on what you've described, it sounds like you might be dealing with generalized anxiety disorder, or GAD. GAD is characterized by persistent and excessive worry about a variety of things, often more intense than the situation warrants. Does that sound like what you're experiencing?
Yes, that sounds exactly like what I'm going through. It's like I'm stuck in this loop of worrying about everything, no matter how small or irrational it might seem. And I can't turn it off. I've tried to distract myself, but nothing seems to work. It's starting to feel like I'm losing control over my own thoughts.
I understand how difficult that must be. Anxiety can be overwhelming, especially when it feels like it's taking over your life. The important thing to remember is that you're not alone in this, and there are effective treatments that can help you regain control. We'll work together to develop a plan that addresses both the mental and physical aspects of your anxiety.
That's good to hear. I've been feeling so isolated, like no one else understands what I'm going through. It's reassuring to know that there's a way forward.
You're definitely not alone, Miss Lewis. Many people experience anxiety, and it's something that can be managed with the right approach. The first step is to identify the triggers that might be fueling your anxiety. Sometimes it's related to specific stressors, but with GAD, it can often feel like there's no clear reason for the worry. That's why we'll focus on both immediate coping strategies and long-term solutions.
I've noticed that certain things make it worse, like work deadlines, or worrying about my family's health. But even when everything's fine, I still feel this underlying tension. It's like I can't relax no matter what I do.
That's a common experience with GAD. The mind can get stuck in a pattern of constant vigilance, always looking for something to worry about, even when there's no immediate threat. One approach we can take is cognitive behavioral therapy, or CBT. CBT helps you identify and challenge the negative thought patterns that contribute to your anxiety. By learning to recognize these patterns, you can start to reframe your thinking and reduce the intensity of your worry.
I've heard of CBT before, but I've never tried it. Do you think it could really help?
CBT is one of the most effective treatments for anxiety. It's a practical, hands-on approach that gives you tools to manage your anxiety in real time. We can also explore relaxation techniques like deep breathing, progressive muscle relaxation, or mindfulness, which can help you stay grounded when your anxiety spikes. In some cases, medication might also be considered to help manage the symptoms, especially if they're severe or impacting your daily life.
I'm open to trying whatever will help. I just want to feel like myself again. The idea of having tools to manage this sounds really empowering. What about medication? I've been hesitant, but I don't want to rule anything out if it could help.
Medication can be a valuable part of treatment, especially in combination with therapy. There are several options, including SSRIs, which are commonly used to treat anxiety. They work by balancing the chemicals in your brain that affect mood and anxiety. If you decide to try medication, we'll monitor your progress closely to make sure it's effective and that you're comfortable with it. The goal is to find the right balance for you, whether that's therapy, medication, or a combination of both.
That makes sense. I feel a bit more hopeful now, knowing there are different options to explore. I'm ready to give this a try and start working on getting better.
That's a great mindset, Miss Lewis. Taking the first step is always the hardest, but you've already done that by reaching out for help. We'll take this one step at a time, and I'll be here to support you throughout the process. Let's start by setting up a plan that includes some CBT techniques, and, if you're comfortable, we can discuss medication as well.
Thank you, Doctor. I feel like I've been carrying this weight for so long, and it's a relief to know there's a path forward. I'm ready to start working on it.
You're very welcome, Miss Lewis. We're in this together, and I'm confident we can find the right approach to help you manage your anxiety. Let's start with some initial sessions focused on CBT, and we'll go from there. Remember, it's a process, and progress might take time, but you're already on the right track by taking action. Let's get started.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a medical professional talking about a Labrador. Now read the question.
So, this morning, we assessed a 4-year-old Labrador who was brought in by his owner after they noticed he had been unusually lethargic and had lost some weight over the past few weeks. The dog is typically very active, but there's been a noticeable decline in energy recently. Upon examination, there is no history of prior medical conditions or any recent infections. However, the owner mentioned that they've been under significant stress at work, which may have affected their interaction with the dog. Initial tests, including blood work and X-rays, came back normal, with no signs of underlying diseases. The dog's behavior and weight loss could possibly be a response to the emotional strain the owner is experiencing, which may have disrupted their usual bond. We see similar effects in therapy and service animals, where the pet's health can reflect the mental state of the owner. The most likely diagnosis at this point is a psychosomatic reaction, where the dog's health is being influenced by the emotional environment in the home. We'll look into improving the emotional connection between the owner and the dog, and monitor for health improvements.
Now look at question 26. You hear a physician talking to a patient. Now read the question.
Started mild, but now it's quite severe.
I see. We're going to use a multimodal analgesia approach to manage your pain, which means we'll use a combination of medications that work together. This should help control your pain better from different angles.
That sounds good. What exactly does that mean?
We'll use a combination of non-opioid medications like ibuprofen and possibly a low dose of opioids, if needed, for more severe pain. By combining these, we can reduce the amount of opioids used while effectively controlling the pain.
Will that be enough to make the pain go away?
It should definitely help. Each medication targets pain differently, so using several together can give better relief than relying on just one type. We're tailoring the treatment to your specific needs.
I trust you. What's next?
I'm going to prescribe a mix of medications, and we'll monitor how well they work together. We might adjust the doses depending on how you respond. In the meantime, we'll keep an eye on your symptoms.
Now look at question 27. You hear two colleagues talking to each other. Now read the question.
The attendance for the Flexibility and Prioritization Techniques course hasn't been great, has it?
No, it hasn't. I thought more people would be interested, considering how crucial it is. We've made sure everyone knows about it, and we even arranged for it to be held in shorter sessions to accommodate shift patterns, but that hasn't seemed to help.
Yeah, though I don't think the scheduling change was the issue. I have a feeling that once staff recognize how these techniques can help them manage daily priorities more effectively, there might be a better response.
Agreed. There's definitely a need for it, but it seems like the staff don't yet see how it applies to their day-to-day responsibilities.
Now look at question 28. You hear a GP talking to a patient. Now read the question.
So, Mr. Smith, I see you've come in today because you're experiencing severe reactions after coming into contact with water.
Yes, that's right. Every time I take a shower or wash my hands, I get these painful red rashes all over my skin.
That sounds distressing. I remember from your last visit you mentioned the rashes appeared soon after bathing, and that you've also experienced itching and burning sensations. Have these symptoms continued?
Yes, and it seems to be getting worse. I'm also noticing the rashes last longer now.
I see. This does sound like a condition called aquagenic urticaria, which is an extremely rare allergy to water. Now, did you say earlier that the reaction only happens with certain types of water, like rainwater or tap water?
No, it happens every time I touch any kind of water, even when I sweat.
Right, that's consistent with aquagenic urticaria. I'll recommend some treatment options to help manage the condition, but we will need to.
Now look at question 29. You hear a trainer talking about how technology is shaping modern dental education. Now read the question.
Welcome to session number 5. Today we're going to dive deeper into how technology is shaping modern dental education. If you remember from last session, We discussed virtual reality simulations and how they help you practice complex procedures in a controlled, realistic environment. We also went over 3D printing technology, where you printed a basic dental model. Now, for today's session, we're going to build on those concepts. You're going to use 3D printing again, but this time for more intricate dental prosthetics. And for the first time, you'll be combining that with our VR platform to practice fitting the prosthetics on a simulated patient. This means we'll be elevating the complexity of the procedures you've already started learning. You'll need to pay more attention to accuracy, precision, and real-time adjustments. We'll also discuss briefly how AI-driven diagnostic tools work, though we'll go deeper into that topic in later sessions. Let's focus on integrating the technologies we've already covered for now.
Now look at question 30. You hear a nurse manager talking to a charge nurse. Now read the question.
Thinking about our next quality improvement initiative.
Yes, last year we focused on improving patient handover communication, didn't we?
That's right. We implemented those standardized forms and had training sessions, which really helped reduce errors.
Yes, I remember that well. It was a bit challenging at first for the team to adjust, but overall, it worked quite effectively, don't you think?
Definitely. But I've been reading more about new approaches to care coordination, and I think we might need to expand our focus this year. With the increasing complexity of patient needs, it's crucial that we continue to refine our processes.
So, we should probably consider rolling out some additional staff training, maybe focus on interdisciplinary communication.
That's exactly what I was thinking. Let's discuss this with the leadership team. They might have suggestions for how to integrate it into our current workflow.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1, questions 31 to 36. You hear Dr. Elizabeth Shaw giving a detailed presentation on geriatric palliative care. You now have seconds to read questions.
My name is Dr. Elizabeth Shaw, and I specialize in geriatric palliative care. Today, I want to address an important but often overlooked aspect of end-of-life care for patients with advanced dementia: recognizing and preserving personhood. It's a challenging area of healthcare, and it's vital that we not only treat the illness but also respect the individual behind the diagnosis. Personhood, in the context of dementia care, refers to recognizing that even as cognitive abilities decline, the individual's identity, preferences, and life history remain important. Dementia patients, particularly those in the advanced stages, often lose the ability to communicate, make decisions, or express their needs. This can lead to a risk of their identity being overshadowed by their illness. The key to effective palliative care in dementia is maintaining dignity and autonomy, despite severe cognitive impairment. This is where the concept of person-centered care becomes essential. As healthcare professionals, we must constantly ask ourselves, how can we ensure that a patient's sense of self and dignity is upheld? How can we honor their wishes, especially when they are no longer able to communicate them clearly? This is particularly critical in dementia care, where the patient's ability to express their preferences is compromised. In collaboration with Dementia Care Australia, we recently conducted a study to investigate how personhood is managed in end-of-life dementia care. This study involved over 1,200 responses from healthcare professionals, family carers, and patients themselves, where possible. The findings highlighted several important gaps in current care approaches. One key issue is the difficulty of making decisions that align with the patient's wishes when those preferences haven't been discussed or documented early enough. Often, families are left guessing what their loved ones might have wanted in terms of treatment decisions, such as the use of antibiotics, pain relief, or resuscitation. This can cause distress for both the family and the patient. The concept of advanced care planning is crucial here. It allows patients to document their preferences while they still have the capacity to do so, ensuring that their values and wishes are respected even in later stages when they can no longer communicate. But unfortunately, as our study revealed, nearly 40% of healthcare professionals have never initiated a conversation about advanced care planning with their dementia patients. This is a significant gap, given the importance of these conversations in upholding patient autonomy and dignity. Another aspect we must address is the family's involvement in care. The family plays a critical role in dementia care, but they often feel unsupported or unsure of their loved one's wishes. In our survey, 70% of family carers reported feeling uncertain or anxious about the decisions they had to make. Many expressed regret over not having had conversations about end-of-life preferences earlier in the disease's progression. Despite these challenges, there are promising examples of excellent person-centered care. In some cases, healthcare teams have worked closely with families, using the patient's life history, values, and past preferences to guide decisions. This helps ensure that the care remains focused on the individual, not just the disease. However, such examples are still the exception rather than the norm. Additionally, pain management is another area where upholding personhood becomes essential. Pain is often under-recognized and under-treated in dementia patients, as they may be unable to communicate their discomfort. Our research found that 25% of healthcare professionals were unsure of how to assess pain in non-verbal patients, leading to concerns about undertreatment. Providing adequate pain relief is not just a medical necessity, but a fundamental human right. When it is overlooked, the personhood of the patient is disregarded. Our study also revealed a concerning gap in healthcare professionals' knowledge about patient rights. For example, 20% of respondents were unaware that patients have the right to refuse treatments, such as hydration and nutrition at the end of life. Without this knowledge, professionals may fail to respect patient autonomy, further undermining their personhood. Ultimately, what we need is a comprehensive, well-funded approach to palliative dementia care that prioritizes personhood. This means investing in training for healthcare professionals so they are equipped to discuss and honor patients' wishes. It means supporting families to help them make informed decisions. Most importantly, it means ensuring that the care delivered is not just about managing symptoms, but about preserving the dignity and identity of every person affected by dementia. We still have a long way to go, but with initiatives like advanced care planning and better pain management protocols, we can move towards a model of dementia care that respects and maintains the personhood of patients. even in the most challenging stages of the disease.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Carter discussing celiac disease. Now, read the questions. You now have 90 seconds to read questions.
I have with me Dr. Carter, an expert in celiac disease, an autoimmune disorder affecting the small intestine. Hello, Dr. Carter. Thank you for joining us today.
Thank you for inviting me. I'm happy to share insights into my journey and the ongoing challenges surrounding celiac disease, particularly the frequent misdiagnosis it faces.
I understand you didn't always focus on celiac disease. Can you share how you transitioned from general internal medicine to specializing in this area?
Absolutely. My journey started in internal medicine, focusing primarily on gastrointestinal disorders. However, my career took a turn when my daughter Emily was diagnosed with celiac disease after years of misdiagnoses. For years, she was told she had irritable bowel syndrome and even a psychological disorder due to the symptoms not fitting the standard profile for celiac disease. Her experience opened my eyes to the difficulties patients face in getting an accurate diagnosis, especially for conditions like celiac disease, which can mimic other disorders.
It must have been a challenging time for your family. What finally led to the correct diagnosis?
It was a long and frustrating process. Emily's symptoms ranged from abdominal pain to severe fatigue and brain fog. These are non-specific symptoms, which is why doctors initially misdiagnosed her. Eventually, after pushing for more tests, a blood test for celiac markers and a biopsy of her small intestine confirmed the diagnosis. This personal experience drove me to specialize in celiac disease, to prevent others from going through what Emily did.
Misdiagnosis seems to be a recurring theme with autoimmune diseases. Why do you think that is, particularly with celiac disease?
You're absolutely right. One of the biggest challenges with celiac disease is that it mimics so many other conditions. Patients can present with symptoms similar to irritable bowel syndrome, IBS, Crohn's disease, lactose intolerance, or even depression. The symptoms can also vary greatly from one patient to another, which complicates diagnosis further. For example, in children, celiac disease may be misdiagnosed as failure to thrive, whereas in adults, it may be mistaken for anemia or chronic fatigue syndrome.
Could you provide some insight into the conditions that are most often mistaken for celiac disease?
Certainly. Some of the most common conditions misdiagnosed in place of celiac disease include irritable bowel syndrome, inflammatory bowel disease, lactose intolerance, and non-celiac gluten sensitivity. However, it's not just gastrointestinal conditions. Because celiac disease can also cause symptoms like joint pain and migraines, it's often confused with fibromyalgia or chronic migraines. This wide range of overlapping symptoms is what leads to frequent misdiagnosis.
That's a broad spectrum of conditions. Given how common misdiagnosis is, What steps do you recommend for patients who suspect they may have celiac disease but have been diagnosed with something else?
The first step is to advocate for yourself and ask for specific testing. A blood test looking for certain antibodies, like tissue transglutaminase antibodies (TTG-IgA), is often the first screening tool. If that test comes back positive, the next step is usually an endoscopic biopsy of the small intestine to look for damage to the villi, which is a hallmark of celiac disease. It's also crucial that patients are still consuming gluten when these tests are done because stopping gluten can lead to false negatives.
How has the awareness and understanding of celiac disease evolved in recent years?
Awareness has improved dramatically, but there's still a long way to go. 20 years ago, celiac disease was considered rare, but now we know it affects about 1 in 100 people worldwide. One of the biggest changes is that doctors are becoming more aware of the non-classic symptoms, such as neurological issues, infertility, and osteoporosis, which can all be linked to celiac disease. These symptoms were often overlooked in the past.
It's clear that proper diagnosis is critical for effective treatment. What is life like for your daughter now that she has a confirmed diagnosis?
Emily is doing very well now, thanks to a strict gluten-free diet. That's the only treatment for celiac disease at the moment, but it has made a world of difference in her life. The fatigue, brain fog, and gastrointestinal symptoms have almost completely disappeared. She's now able to live a normal, healthy life.
It's wonderful to hear she's doing so well. Before we wrap up, can you tell us about any ongoing research or developments in the treatment of celiac disease?
There's exciting research underway, including efforts to develop a vaccine that could allow people with celiac disease to consume gluten without damaging their intestines. Additionally, there are medications in development aimed at reducing the immune response to gluten. However, for now, the gluten-free diet remains the most effective treatment.
Thank you, Dr. Carter, for sharing your insights and personal story with us today. It's been incredibly informative.
Thank you for the opportunity to raise awareness about this important issue.
That is the end of Part C. You now have 2 minutes to check your answers.